When you see a doctor, you have the right to have a professional interpreter. This language expert interprets everything you say and everything the doctors and nurses say so that you understand each other perfectly. Providing an interpreter is the responsibility of the doctor or hospital. Requesting an interpreter will not cost you any extra money. Mrs. Lee's doctor provided an interpreter when they met for her daughter's checkup. The interpreter helped Mrs. Lee understand exactly what she needed to do to help her daughter stay healthy. Do not use your own family or friends as interpreters. This needs to be done by a trained professional. You cannot use any children as interpreters. When scheduling an appointment with any new doctor, be sure to let them know that you need an interpreter in your language.
You can tell them the language you would like to speak during the appointment so they can use an interpreter at no cost to you. Clinics use trained medical interpreters, usually on the phone, who are required to keep all conversations private or confidential, which means they are not allowed to share your information with others.
Trained interpreters are helpful because they have learned medical terms the doctor often uses and can share them in your language. Remember that everything you say to the doctor in your appointment is private, and the interpreter and the doctor are not allowed to tell anyone else what you discuss without your permission. Let's practice asking for an interpreter together. You can say, "No English, I speak Swahili." Okay, now you try it. Very good. Let's try it one more time. Excellent. It is also your right to have privacy whenever you have a doctor's appointment. You do not need to allow your spouse, family friend, or the person from IRC who drove you to the appointment to be in the room with you during your appointment unless you want them there. If someone comes into your appointment with you and you do not want them there, simply tell the nurse or doctor through the interpreter that you want privacy for the appointment and ask the other person to leave the room. It is important that the interpreter says everything that everyone in the room is saying during your appointment. It is easier for the interpreter to say everything you have said if you only say one or two things, and then let him tell your words to the doctor before you say more. The doctor will talk directly to you, not the interpreter. If the doctor is talking and the interpreter isn't telling you his words, you should remind the interpreter to tell you all of the doctor's words. There might be times when you do not understand what the interpreter or the doctor is saying. The doctor wants you to ask for a better explanation anytime you don't understand something. The doctor will not be angry if you ask lots of questions. In the U.S., doctors expect their patients to ask questions. They don't have any way to know what is confusing to you unless you tell them. You can say something like, "I don't understand about the problem you say I have. Can you explain it again in a simpler way?" Okay, let's practice asking the doctor questions. I will say some of the questions you might ask your doctor, and then you say it too. "Doctor, do I need to take any medicine?" "I don't understand what you just said. Can you explain it again, please?" "Do I need to see another doctor for this problem?" When should I come back to see you again? Remember, you should always ask the doctor to explain again anytime you don't understand or if he talked too quickly for you to remember.